Hi, my name is Jillian Taylor, and today I will be bringing you a presentation about cardiovascular disease and pregnancy. This presentation encompasses 5 sections. First, I will give you an overview of cardiovascular disease. We will then talk about the burden of disease in the pregnancy population. We'll then talk about exacerbating factors in pregnant women and what causes cardiovascular disease. We'll then talk about communication strategies and how to get correct information out to pregnant women on how to protect themselves and be aware of their risks for cardiovascular disease. And at the end, I will give you a brief summary of today's presentation. So first, I will give a broad overview of what cardiovascular disease is. So cardiovascular disease, or sometimes referred to as CVD, is a broad term that can refer to a number of heart conditions according to the American Heart Association. This can include heart disease, heart attacks, stroke, heart failure, or heart valve problems. These can be genetic in nature, or it can be from birth that these problems arise, and it can also be contributed to lifestyle factors. Before speaking about the pregnancy population specifically, it's important to understand the burden of disease of cardiovascular disease. Heart disease is a leading cause of death in the United States as of 2023, according to the Center for Disease Control and Prevention, and it's also the single largest cause of indirect mortality, accounting for 33% of pregnancy-related deaths. Every year, about 805,000 people in the United States have a heart attack. The chart below shows different ethnic groups and the percentage of deaths that are attributed to cardiovascular disease. It's important to note that there is a disparity in health here, and that we can see Blacks who consider themselves non-Hispanic have the highest rate of cardiovascular disease deaths across all ethnicities and races. As previously mentioned, cardiovascular disease does have a genetic predisposition component to it, but it is important to notice that especially in pregnant women, there are exacerbating factors that can increase the frequency of cardiovascular disease. These exacerbating factors include physiological demand, presence of risk factors, environmental factors, and systematic and systemic racism. When we talk about pregnancy, we must consider physiological demand. Below, you can see a chart that has a list of items that are considered physiological cardiovascular adaptations in pregnancy. This includes increased heart rate, increased blood volume, and increased blood pressure, and increased respiratory rate. These are just a few things that become taxing on a woman's body when she is pregnant. The presence of cardiovascular risk factors are also one that we cannot overlook. This includes change in childbearing age. Many women are choosing to have children older, which does make them more high risk, even if they are healthy. In vitro fertilization, especially postmenopausal or perimenopausal, increases risk of cardiovascular disease. Those that have diabetes mellitus or type 2 diabetes, as well as existing hypertension before they get pregnant, are all considered cardiovascular risk factors. Also, touching on the environmental factors that are external to the body are very important when you're looking at cardiovascular disease frequency and burden of disease in pregnant women. As you can see below, there is a chart that highlights 5 environmental factors, the first being maternity deserts, where women have no or limited access to prenatal care. We also have to look at walking paths. We want pregnant women to be moving their bodies and be active, but if there are unsafe environments to get exercise outside, that makes that increasingly more difficult. Food deserts also exist, in which there are little to no access to fresh fruits and vegetables. So obtaining a healthy diet that is balanced can be increasingly difficult with food deserts. You must also consider air quality and water quality because both impact fetal development. And lastly, the presence of teratogens or chemicals that will cause developmental concerns with fetuses. And this is both intentional and unintentional exposure. So intentional being to tobacco smoke, and unintentional being to pollution, chemicals, or things that are found in food. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." When talking about maternal health, cardiovascular disease, and systemic and systematic racism, we cannot turn a blind eye to the health disparity that exists between Black women and their white counterparts. Below is a chart pulled from Center for Disease Control and Prevention in 2018. Here we can see the Hispanic women death rate per 100,000 live births is nearly 12%. Non-Hispanic white women is about 15%, and over double of that is non-Hispanic Black women at 37.3%. This shows that there is a true issue within the healthcare system regarding trust of Black women in their providers, Black women being listened to and heard and acknowledged when they have concerns, and healthcare providers' willingness to act when things are brought up that are concerning in a pregnancy for a woman of color. When talking about cardiovascular disease in pregnant women and mitigating the rate of occurrence, it's very important that communication strategies are highlighted and are approached from many different ways. Communication strategies include national campaigns, social media campaigns, in-person, one-on-one, and group education, as well as healthcare provider education. One form of a large communication strategy that can reach many places is the utilization of national campaigns. Below, you can see a poster that was created by the CDC, the Center for Disease Control and Prevention, called the Hear Her campaign. This campaign was launched after the maternal mortality of Black women really was skyrocketing, and the CDC felt as though they had to do something different. They utilized Allison Felix, a gold medal track star, as the face to help publicize this campaign. Below, there are many symptoms that could be alarming if a woman has been pregnant now or within the last year. And if any of those symptoms arise, they are instructed to go directly to their provider and ensure that their issues are being addressed in a timely fashion to help decrease the cases of maternal mortality. Social media campaigns are also a great way to reach women of childbearing age. According to the Pew Research Center, most women of childbearing age use Facebook, YouTube, and Instagram, with most engaging on a daily basis. These are great locations where campaigns can post pictures, reels, videos, and have open Q&A sessions to ensure that if women are having questions about the risks of cardiovascular disease, the algorithm can help point them to the right direction and getting answers and knowing when they need to speak to their providers. In-person education is also crucial, and it's important that the information that's being delivered is linguistically appropriate, culturally appropriate and sensitive, no higher than a 6th grade level, and is actually being reviewed with health educators and healthcare providers. Oftentimes, women are just handed a pamphlet or a stack of information, but it's really important that these materials are gone over one by one, read with the patient, and ensure that they're being asked if there's any questions they have or need clarification on any information. Provider education is key. Below you can see an image that says know your bias, implicit bias. Every single one of us have implicit biases, and it's very important that we take the time out to determine and to look at what those biases are, how it impacts the way that providers are delivering care, and how to overcome those biases and be better listeners, more receptive to others who are not like us, and also taking cultural training to understand better those clients and patients that we serve. In summary, cardiovascular disease in pregnant women is extremely dangerous, but there are ways to mitigate it, often through education and knowledge directly to the patients. On this slide, you can see all the references that were used throughout this presentation. Thank you.